Eric Hammer here, registered physiotherapist and owner of Home Comfort Physiotherapy. Today, I'd like to talk a little bit about osteoporosis, but before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, what osteoporosis is, it's when the bone density reaches a certain low level and a patient is at a greater risk of potentially fracturing the bone. So this could result from a fall of some type. Sometimes for certain patients it could be just like a twisting action or a small movement or something that occurs over time, for example with the spine, in which a patient might get a compression fracture or something along those lines, right? Or let's say again with a fall, a hip fracture is quite common with an individual that has osteoporosis and falls. So the idea around the density of the bone getting thinner and thinner. And so as a result of this, one of the things, again, from a physiotherapy standpoint, that we want to do in such cases is work on strengthening the muscles that attach onto the bone to help with, again, increasing to some degree the density of the bone, but then also in a large part trying to build up the strength so that we prevent these different fractures from taking place, right? So for example, building up the strength in the legs so that an individual has the ability, right, to do sit to stand or stairs or walking appropriately. Another thing along with this sort of strengthening component and strengthening in terms of also postural strengthening is this idea of fall prevention. So perhaps setting up a program with an individual in order to prevent falls and to perhaps improve balancing. Again, going back to this idea of this increased risk of fractures, it's going to be really important for an individual to have decent balancing and, again, just setting up different scenarios to be aware of fall prevention, right? So good footwear, again, improvements, let's say in balancing and proprioception, looking around the household to make sure that there's no items that somebody might trip on. So these all can be helpful for somebody who has osteoporosis. If you have any questions, concerns, feel free to leave a comment below. And if you can benefit from in-home physiotherapy, feel free to reach out. I do have a link below. And please check with a physiotherapist to make sure that this or any other of my information here is appropriate for you. Thanks again for watching and have a great day. Take care.